Handle Your Business, a weekly podcast discussing a little of this and a little of that. Handle Your Business appropriately blends serious topics with fun topics, all in an effort to help you have a good or better life. So join me, your host, Lady Lashley, and some amazing guests every Sunday at 5 p.m. to explore everything from financial management to dealing with relationship challenges. Put it in your calendar every Sunday from 5 p.m. Tune in to Handle Your Business for a very helpful half hour to get you ready for the week ahead. For more details, follow at Lady Lashley TT on Instagram and Facebook. Handle Your Business. Welcome to Handle Your Business with yours truly, Lady Lashley. Today, we are going to be discussing mental health and COVID. And I have with me Tobago's only clinical psychologist, Dr. Alina Williams. Dr. Williams, good afternoon.
Hi, good afternoon, Glendora, and good afternoon to the listening public, those that are tuned into this podcast. Good afternoon, and let me just extend greetings for 2022 to everyone.
All right. How have you been doing just as a person having to navigate all of this that's happening now?
Okay, well, let me just correct one thing. I'm not the only clinical psychologist in Tobago. I'm the only one currently attached to the Scarborough General Hospital that treats adults, but we do have one that deals with children, and we have a few that work in private practice as well, right?
Oh, wow. Okay.
Yeah. So I have been doing okay. Of course, just like everyone, I am dealing with the ins and outs of going through a pandemic and having to navigate people that are also dealing with the impact of this pandemic. I am lucky to have tools available to me that helps me to manage my own mental health. And so I am really interested in helping people navigate their own mental health issues during this period.
Okay, happy to hear that. And let me just apologize to those other clinical psychologists. Had no idea that we had more of them. At least this has happened in a short space of time. The last time I checked, there weren't that many. So very, very happy to know. Yeah, very, very happy to know that we have some more, especially one that deals with the children. Now, Doc, you talk about you navigating your own mental health. In our space, in Tobago, in Trinidad, in the Caribbean, in our diaspora, many of us, when we hear the term mental health, for some strange reason, we have a negative reaction. And so I want to start off today by asking you to tell us, what does mental health mean? What is mental health?
So mental health is essentially the way that people think, behave, and feel. Mental health has to do with your emotions, your cognitions, and your behaviors. And why mental health gets such a bad rap is because most times in the media, we see the extremes of it being portrayed. So in terms of thinking, we have the person that has the strangest thoughts, like, the FBI is after them, or that some alien has kidnapped them. In terms of behavior, we see, somebody walking the streets naked, or people stripping their clothes, or, just screaming at public persons or cutting themselves. So that's why we tend to think of it so negatively, but mental health exists on a continuum, and there are times that we would be mentally healthy and we're able to function adequately, and there'll be other times that, whether it's external things or internal factors, they impact how we think, how we feel, and how we behave. So mental health essentially exists on a continuum, and day by day, we are fluctuating along that continuum.
Okay. I suppose we need to continually put out that message, because it's going to take a while to get some of us, to wrap our minds around that. And even more so, you being a psychologist, a clinical psychologist, there are many of us who, whenever we hear the term psychologist, we also think, about negative things. Maybe you can also explain what is the job of a psychologist, and in your case, especially a clinical psychologist.
Okay, so psychology essentially is the science of studying the mind, right? mind and behavior. And what a clinical psychologist does is essentially work with people that may have a diagnosable mental illness or treat a wide variety of mental health conditions. So it doesn't mean that the person has to be on the extreme where they have a mental illness. But as I mentioned before, we're always fluctuating along a continuum. And the absence of mental illness is not an indication that you are mentally healthy. So a clinical psychologist does a variety of assessments, work within a multidisciplinary team to help treat and diagnose and manage a wide variety of mental health conditions. It's more than just, quote unquote, dealing with mad people. We deal with people that are experiencing normal fluctuations in day-to-day functioning, whether it's due to things like a divorce, things like losing a child, things like infertility, and of course, a pandemic.
Now, it's very interesting that you said that, and you have a line there that I'm going to pull out because I really, really like it. You said the absence of mental illness does not mean that we're mentally healthy. Or right. Something to that effect. And then you went on to talk about some of the everyday issues, that one may see a psychologist for. And as you hit on the pandemic there, tell me, what are some of the mental health issues that would normally affect us versus, what and those that have come on because of the COVID-19 pandemic and even the illness itself?
Yeah, right. So one thing we've definitely noted for sure is that many persons are experiencing personal loss and grief, right? Because of the COVID-19 pandemic, when we think of grief, we immediately think about people that have lost their lives, but it's more than just losing lives. There's a profound loss of what is considered a normal life. And the peace and familiarity that came with what was considered normal. Most people on a Friday evening, they might go out for a drink with friends. On a weekend, we go to the beach, we go to the waterfall, things like that. And so there's a sense of loss of normalcy. There's also grief reactions to things like the cancellation of trips or celebrations or major events in a person's life. Some people have had to postpone their wedding or downsize their wedding. There's probably the loss of momentum in a person's business and career. So we're dealing with that. We're also dealing with, for example, exhaustion and burnout. And this is especially prevalent in healthcare workers or essential workers that have had to keep going during this pandemic while also trying to keep their families safe. We also experience prolonged isolation, social isolation. And this has resulted in depression, anxiety, for some people, apathy. It's like they just don't care anymore. Every day is every day. There's no longer this sense of joy and purpose. And that has actually impacted people's quality of sleep. We also find that there's increased use of alcohol and drugs at home. When we go out to drink, we spend $50 on a drink, so we might have 2 drinks and call that George. But when you buy alcohol in the supermarket and you have the ability to mix your drinks as strong as you want, we find that a lot of people coped with the social fallout of the pandemic by drinking more at home. There was also a marked increase in interpersonal conflict. So, when you lock up with people at home, you tend to kind of start what we describe it as having cabin fever. So, there's that tendency to get moody and get irritated and get frustrated just with the people in the home. And, I'm not even going to touch on the bigger issues like increasing domestic violence and sexual abuse of minors, but that has also occurred. And there's also intrapersonal conflict. So people having more time to think about themselves, to look inward. And for people that have had unresolved issues in the past, this has been a moment where self-awareness has kind of hit them like a ton of bricks, and they're now having to navigate things that they may have repressed or pushed aside, like childhood trauma or any other intrapersonal issues that they sort of would have been distracted by due to the normal functioning of their lives.
Yeah, you're saying that, and I mean, many of us can probably just think about, you know, ourselves or people around us. When you started off talking there, we can easily see some of the more visible people or types of people who are affected. You talk about the essential care workers and those sorts of people, it's expected, but the average person in this space being affected. I mean, in the beginning, you talk about the ability to travel. Let me tell you,
yes.
That thing is still bothering me in a way that I didn't even realize that it was bothering me. I think I legit got depressed when I realized I can't go anywhere. I couldn't go anywhere, and that there was vaccine discrimination. I mean, even though I knew it will end, it really just kind of hit me like a ton of bricks. And then you also talk about, for some of us now, having been forced to really face some of your own personal issues, the childhood traumas and so on that you're dealing with. If you could just go in a little bit for me into there are many of us who dismiss when we hear childhood traumas affecting us as an adult, we become dismissive, you know, because you feel, well, as a big woman, as a big man, that dying had nothing to do with me, you know, that's when I was a child. Can you speak to how childhood traumas can really affect you as an adult, and perhaps give maybe an example of a type of trauma?
Sure. So when we think about trauma, think about a glass being shattered. You know, when an individual experiences a traumatic event, no matter what age it happens, it's like a glass being shattered. And as you try to rebuild that glass, it will not go back in the way that it was originally. And so what trauma does is that it actually rewires the brain with a new set of information that you have sort of used to explain the trauma, and that changes how you see yourself, how you see other people, and how you see the world. So let's say somebody that experienced sexual abuse by a relative. What that trauma may have done is change how they see themselves. So now they might start to think, I am unworthy, I am a dirty person, I deserve that, I did something wrong and it was my fault. And so they become very self-critical as adults, or they may become very perfectionistic as adults because they want to control everything. You might find that it changes how they see other people. So now they view other people as untrustworthy, always having malicious intentions, always having ulterior motives. And so as an adult, they may build up walls which affect their ability to form healthy relationships. You might find that they're constantly in cycles of toxic relationships because that is how they see people. And then in terms of thinking about the world, they may generally think that the world is unsafe, that, you know, there's nothing that you could do to keep yourself protected. And for some people, they go to the extreme. They become sexually promiscuous because they tell themselves, well, this is what my body is for. And, you know, I am just going to take front before it takes me, you know?
So Doc, you're saying that, and in what you have just described there, you use it generally people, but I want to ask you this. Is there a difference between the genders, male and female, man and woman, in terms of how they may respond and how those things that you're talking about, those signs and symptoms, what they may look like?
Yeah, definitely. And it all has to do with the way that we are socialized. You know, so for example, a woman that experiences traumatic events would tend to elicit more sympathy from others, more empathy, and they might be encouraged to talk about it, which to some extent would allow them to process the event. But for men, it's seen very differently. They're supposed to be stoic and supposed to be able to handle anything that comes their way. So what we find is that the expression of the event might be different. A woman might internalize the event and so turn her emotions inward. She might engage in self-harm, she might feel depressed or suicidal, whereas a man would externalize their emotions and turn their emotions outward. So they engage in aggressive behaviors. They go from being a victim to a perpetrator. They repeat cycles of abuse that they may have experienced. So anything of that sort. I'm just using abuse as an example of trauma, but it could literally be anything from being in a serious car accident to undergoing a serious medical emergency. And, you know, as we're talking about COVID-19, we are noticing in Tobago people having COVID-19 psychosis post-diagnosis, right? And what we're finding is that the trauma of being diagnosed with COVID is actually affecting some people, where they're becoming extremely paranoid now about their own health. They're unable to relax. They're scanning their body constantly because they keep thinking that something is wrong, and they're just not able to function as they did before having COVID. And I'm not talking about physical symptoms. These are all mental symptoms that they're having.
Wow. How does one, if there are people like that who happen upon this podcast and they're hearing what you're saying, how does one begin to address that?
So definitely, if you find that it's overwhelming and you're unable to manage the experiences that you're going through, I would advocate for seeking professional help. But one thing I always say too is that people are a lot more resilient than we think. And so one of the things that we should do is always look at the ways we've coped with previous events that have been distressing or hurtful or just significant in terms of having a negative impact on us. And when we look at ways that we've coped before, it allows us to develop a plan for coping in this immediate situation. So if you learn yourself, if you become self-aware, you could say, hey, you know, this works for me. If I'm feeling stressed, I could go for a run and I usually feel better. Or if I'm feeling bad about something, I could talk to this person and I'm usually feeling better. So one thing you want to do is rely on your past coping mechanisms. Now, if you don't have coping mechanisms in place to begin with, then definitely seeking professional help would allow you to start establishing those coping mechanisms. But because physical health and mental health are very much interrelated, one thing you want to do is take care of your body. Sleep and appetite are very important factors when you're trying to manage your mental health.
Wow, and a lot of us actually suffer with insomnia. Many people, and as you talk about those who may have had COVID and then they ended up having some version of psychosis, I'm wondering about those of us who have not been diagnosed with COVID,
right,
but have a similar thing. And maybe I checked it myself here because the paranoia is real, you know. What would you recommend to people who, you know, can't sleep? A simple thing like being able to get the rest so that your body could rejuvenate and that you're able to stay healthy. Is there some sort of thing that you can say to those of us who may be battling with that?
So let me say, sleep is actually one of the first things to become eroded when a person is about to experience what we call, now this isn't the correct term, but what we call a nervous breakdown. Sleep is usually the first thing that goes out the window. And on the flip side, sleep is actually a very strong protective factor against developing a mental illness. So sleep is very important. Now, most of us don't practice adequate sleep hygiene. And so if you want to manage your sleep effectively, sleep hygiene is very key. Just some important points about sleep hygiene. One is like going to bed at the same time every night, waking up at the same time every morning, regardless of if it's a public holiday or the weekend. You want to establish a set routine. You also want to limit your use of devices about an hour before bedtime, because blue light, which devices emit, slows down the production or the emission of melatonin in the brain. And melatonin is that thing that signals to your brain, hey, it's time to sleep. So when we're exposed to blue light, it's it's as if we're exposed to daylight, where the brain starts to think, okay, well, she's supposed to be awake, he's supposed to be up. So you want to limit your devices an hour before bedtime. You also want to use your bedroom for two things only: sleep and sex. Your bedroom should not be for watching TV, for doing business conferences, for, planning things. No, your bedroom should be only for sleep and sex, so that your brain makes the association once you get in bed that it's time to wind down to get your rest. So sleep hygiene is very crucial. And of course, if what is preventing you from sleeping is ruminating or worrying, so when patients tell me, doc, I'm not able to sleep, the first thing I say is, which is it? Are you having problems falling asleep or staying asleep? And when they say they have problems falling asleep, I usually ask, are you up thinking about your day or planning for the next day? Are you worrying? Are you ruminating? And they will say yes. So what you want to do to manage that is try to journal your worrisome thoughts. Write them out on a piece of paper and write ways that you could manage them. And then once you do that, you put it aside and you try to get to bed. If you find that the thoughts come back up in your head, you say, you know what, I'm going to write that down tomorrow. Now it's time to sleep. And so these are ways that you help to prevent rumination or worrying from keeping you up at night.
Wow. Well, I just learned I need to turn off my Kindle an hour earlier. And
Yeah.
the one good thing I am going to milk, like you said there, because I strongly believe it, even though I didn't know about the psychological reasoning behind it. Your bedroom is a sacred space. Take out the TV. Take out the TV.
That's right.
Yeah, I don't understand it.
No, you're not supposed to have your TV in your bedroom.
Yeah, man, light some candles, have a little soft music, make the thing for what it is for. Yeah. I am so happy. Listen, y'all, it's not me saying that. It's Dr. Alina Williams, clinical psychologist. You know how long she had to study to be a clinical psychologist? All right. Dog, time flies when you're having fun. Just as we're wrapping up here, in terms of something that I brought up earlier, I asked you about depression, and we spoke about stress. What I found in my network is that some people, now I could be really off with this, some people seem as if they've hit depression in a real bad way, but they just leave it as if it's regular stress, especially if I say something like, why not see a counselor? Why not see a therapist? Why not go to a psychologist? Is there a difference between stress and depression? And maybe is there a deeper level of depression to tell you, well, okay, I need to see somebody quick?
Yeah, definitely. One thing that is very helpful is to distinguish between normal and abnormal sort of behaviors or presentation. So it's normal to feel stressed and it's normal to feel sad from time to time. These are things, even anxiety, these are things that all of us experience, right? When it becomes abnormal is when you want to say, okay, now is when I need intervention. And so what do we look for to distinguish that? One, we look for whether the behavior is deviating from norm. So if you wake up, you feel sad, but your sadness lasts a few hours or it lasts just a few days and you're back to normal, that's fine. But if it is your sadness is going on for weeks and for months, that's a deviation from norm, because that's not how normal sadness or normal stresses work, right? You also want to look at dysfunction. Is the symptoms that you're having causing you to not function in your work, in your personal life, at home, at school, things like that? So I could be sad, or what we call, I feeling depressed. I could be depressed, but go to work, go and have a line with my friends, cook, clean, things like that. But the person with clinical depression finds it hard even to just get out of bed and brush their teeth. They can't function. So you want to look at, am I functioning or am I not functioning? You also want to look at distress. Are my symptoms causing me to feel distressed or causing others to feel distressed? Is it that it's damaging and interfering with my ability to reach goals? That is what you want to look for too. So somebody could be sad, but they're not sad to the point where they feel completely distressed by it. And if you feel that you're sad and distressed simultaneously, then that means that it probably warrants clinical intervention. So we want to look at a few things, Glendora: frequency of the symptoms, intensity of the symptoms, and severity of the symptoms. Just keep that in mind. FIS. Is this happening very often? Am I sad about 4 days every week or every month? Am I intensely sad? Is it just a sadness that I could shake off and say, oh, let me go to the beach and I'll feel better? Or is it that no matter what I'm doing, I'm feeling the same level of sadness, the same level of depression, the same level of stress? And then severity. My symptoms impacting in a big way my ability to function in society. There's one thing to feel sad, and there's another thing to decide, I want to die. I don't want to live anymore. That's severe. So those are some distinctions that would help a person to navigate whether what they're experiencing is mild and just related to some external situation that they could probably adjust to eventually, or whether it's chronic and severe and it perhaps requires clinical intervention.
Right. Thank you very much for that. And last question before we go. With respect to noticing all of these things, I have come to believe in what we label as mental health first response, right? And this is the people around you, family, friends, co-workers, etc. I want you to talk to both us as individuals and of course us as people who are around other individuals. How can we distinguish between when somebody may need an intervention and what can we actually do to provide any sort of support?
Right. So one of the first things is to look at if there has been any changes in the same 3 things I mentioned that defines mental health. Has the person's behavior changed? Is there any change in their behavior? Have their thoughts changed? Are there differences in how they think and how they process information, how they're making decisions, and how they are feeling? Are they reporting feelings of sadness, numbness, emptiness, apathy, distress, confusion, things like that? So you want to look at any changes that might indicate that something is happening. This is for the person themselves who may have a mental health complication, or for a relative that is observing something is wrong. Like you might notice that all of a sudden your child is withdrawn and they're spending all their time in the room, or you might notice that grades have dropped, or you might notice that someone that once had, thoughts that life is great and I feel hopeful about the future is all of a sudden talking about, what is the point of life? Why am I on earth? So you want to notice differences. And then I always say one of the best things you could do is to normalize the experience of going and have a mental health checkup. The same way somebody will go to the doctor if they're not feeling well, and that's very normal. The same way if your car not working good, you go to the mechanic, and that's normal. If we normalize going to a mental health professional when you're not feeling mentally well, then it doesn't become a taboo thing. It just becomes the norm. You want something to wear to an event, you go to a seamstress. It's the same thing. If you feel like you're not able to function well because there's some disturbance in your thoughts, your emotions, or your functioning, you go to a mental health professional. So the family or friend could normalize it that way. Hey, I noticed that for the past few days, you're looking down and I observe you crying to yourself. Maybe you should go and talk to a mental health professional. They might be able to let you know what's going on. Just normalize it. The more we normalize it, the more people would be willing to engage in treatment-seeking behavior.
Doc, thank you very much. Time flies. I am going to end by saying just what you said earlier. The absence of a mental illness does not mean that you're mentally healthy.
That's right.
Doc says normalize seeking help. All right.
Yeah.
So go and get the help. Thank you very much. Dr. Alina Williams, remember, if you're listening to this podcast, the whole point of it is to get you to handle your business. Thank you, Doc. Until the next episode.
Thank you, Glendora, and thank you, Tobago.
Handle Your Business, a weekly podcast discussing a little of this and a little of that. Handle Your Business appropriately blends serious topics with fun topics, all in an effort to help you have a good or better life. So join me, your host, Lady Lashley, and some amazing guests every Sunday at 5 p.m. to explore everything from financial management to dealing with relationship challenges. Put it in your calendar every Sunday from 5 p.m. Tune in to Handle Your Business for a very helpful half hour to get you ready for the week ahead. For more details, follow at Lady Lashley TT on Instagram and Facebook. Handle Your Business.